Hello and welcome to the Senior Medicare Patrol SMP Medicare versus Medicaid presentation sponsored by the Wyandotte Leavenworth Area Agency on Aging and ADRC. That's Aging and Disabilities Resource Center. Today we'll be discussing Medicare versus Medicaid. These are two separate programs and it's important to know how they differ, along with what they cover and who is eligible for them. This presentation will start by going over the differences between Medicare and Medicaid. Then we'll branch out into the basics of Medicare and give some information on Parts A through D. To bookend this section, we'll go over who is eligible to sign up for it and how to enroll. After that, Medicaid 101 will be like Medicare 101, where we'll go over basic information on Medicaid and then who is eligible to apply for it and how to enroll. Medicare versus Medicaid, what is the difference? Medicare is a federal program that provides health coverage if you're 65 and up, or if you're under 65 and you have a disability. With Medicare, you should be able to receive it no matter your income. Medicaid is a state and federal program that provides health coverage if you have a low income. They are both insurance programs that are administered by the government, but their differences lie in what services they cover and in the cost sharing between yourself and your insurance. Medicare is a federally run and funded health insurance program for those 65 and up. It's also for those with end-stage renal disease, or ESRD, or younger individuals with disabilities. The two main Medicare coverage options are traditional Medicare and Medicare Advantage, aka Part C. Traditional Medicare, also known as Original Medicare, covers Part A and Part B, so hospital and medical insurance. Along with Parts A and B, individuals can add Part D coverage for prescription drugs. We'll go into detail on Medicare Advantage later in Part C. Medicare is broken down into 4 parts. Part A, which covers hospital insurance. Part B, that covers medical insurance. C, more commonly known as Medicare Advantage, which are supplementary plans to enhance your Medicare coverage. And Part D, it covers prescription drugs. So we're going to go into each part and talk about what they cover, starting with Part A. Part A covers hospital insurance, so inpatient care in hospitals, skilled nursing facility care, hospice care, home health care, and nursing home care in the form of inpatient care in a skilled nursing facility that's not custodial or long-term care. Most people aged 65 or older are eligible for Part A for free if they have worked and paid Medicare taxes long enough, but there are some that must pay a premium for it. If you're interested in finding out more about Part A costs or how to find out if you must pay a premium, you can go to medicare.gov. A link will be provided in the description box below. It covers 2 types of services within medical insurance: medically necessary services and preventative services. Medically necessary services are services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. Preventative services deal with healthcare to prevent illness, such as the flu, or to detect it at an early stage when treatment is most likely to work. Things that would fall under those categories and would be covered by Part B is clinical research, ambulance services, and medical supplies like wheelchairs and walkers. Some aspects of mental health coverage, like inpatient and outpatient care, and even partial hospitalization, are covered. And finally, Part B also covers a limited amount of prescription drugs for outpatients. Medicare Advantage plans, or aka MA, and also known as Part C, are an alternative to traditional Medicare that individuals can enroll in. They are run by private Medicare-approved health insurers who must follow rules set by the Medicare program. They typically have plans that include Part D in concert with Parts A and B. If you join a Medicare Advantage plan, you'll still have Medicare, but you'll get most of your Part A and Part B coverage from your Medicare Advantage plan, and not your original Medicare. With MA, annual out-of-pocket costs are limited. Once you've reached the MA's plan limit, the plan pays 100% of the cost of covered services for the remainder of the year. C may cover some routine Medicare, such as dental care, like x-rays, exams, and dentures, vision care for glasses or contacts, or even care for hearing, like testing for hearing loss or to obtain hearing aids. The last part of Medicare is known as Part D, and that covers prescription drugs. Now, there are 4 different tiers in Part D with a range of prices to fit any budget. The first tier having the lowest copayment and the most generic prescription drugs. The second having a medium copayment with preferred brand name prescriptions. The third tier having a higher copayment with non-preferred brand name prescription drugs. And finally, the specialty tier that has the highest copayment with high-cost prescriptions. Drug is in a higher tier than you have, and your prescriber thinks you need the drug instead of a similar drug in a lower tier, you or your prescriber can ask your plan for an exemption to get a lower coinsurance or copayment for the drug in the higher tier. Also, something to keep in mind, plans can change their formulates at any time. Your plan may notify you of changes that affect drugs that you're taking. You can go to medicare.gov/plan compare to get specific Medicare drug plan and Medicare Advantage plan costs and to find contact information for the plans you're interested in. For help comparing plan costs, contact your State Health Insurance Assistance Program, SHIP, which is known as SHICK in Kansas, as it stands for Senior Health Insurance Counseling for Kansans. A number we provided at the end of this presentation and in the description box below. Eligible for both Medicare and Medicaid, you can have both. The 2 programs will work together to provide you with health coverage and to lower your costs. To be eligible for Medicare, you must be 65 or older, you must be a U.S. citizen or a permanent legal resident who's lived in the U.S. for 5 years, and you must be either receiving Social Security or Railroad Retirement Board benefits, RRB. Or you have worked long enough to be eligible for those benefits, but are not yet collecting them. There could be you or your spouse is a government employee or retiree who has not paid into Social Security, but has paid Medicare payroll taxes while working. If you're under 65, there is still a chance you qualify for Medicare. You are eligible if you have been entitled to Social Security disability benefits for at least 24 months, and they must be consecutive. Or you receive a disability pension from the Railroad Retirement Board, along with meeting other conditions set by them. You can also qualify if you have Lou Gehrig's disease, aka amyotrophic lateral sclerosis, or ALS, which qualifies you immediately. Or if you have permanent kidney failure that requires regular dialysis or kidney transplant. Now we've gone over what Medicare is, what it covers, and who is eligible for it. We can move on to how to enroll in Medicare if you haven't already, are planning to, or if you're just curious on how the whole process works. Some individuals can be automatically enrolled for Medicare Parts A and B by the Social Security Administration if they are receiving benefits from Social Security or Railroad Retirement Board benefits, have ALS, or are younger than 65 and have a disability. Those eligible for Medicare on the basis of disability are automatically entitled to Part A after receiving disability benefits for 24 months. Disabled federal, state, and local government employees who are not eligible for monthly Social Security or RRB benefits may be entitled to disability benefits and be automatically entitled to Part A after being disabled for 29 months. Over 65 and want to enroll in a separate drug plan or Medicare Advantage plan, you must have Part A or Part B in order to qualify. Not receiving benefits from Social Security or RRB at least 4 months before turning 65, you will need to enroll in Medicare on your own. It's important that you should know about the initial enrollment period. The initial enrollment period is a 7-month period designed for you to enroll in Medicare. It is a personalized system that begins 3 months before you turn 65, includes the month of your birthday, and ends 3 months later. If you don't enroll during the IEP when eligible, you can enroll during the general enrollment period, which starts January 1st and ends March 31st of each year. There are other occasions in which you can enroll for Medicare called special enrollment periods. We'll be providing a link in the description box below if you'd like to see if you qualify for a special enrollment period. If you are within your IEP and would like to enroll, you can do it online with the Social Security Administration at www.ssa.gov/benefits/Medicare. The webpage will look like the image to the right, and a link will be provided below. You can also go to your local Social Security office. The closest location for Wyandotte and Leavenworth County is located on 850 Nebraska Avenue in Kansas City, Kansas. That brings the end to the Medicare section, so now we'll be moving on to Medicaid. It is a joint federal and state program that provides health coverage for millions of Americans. It provides coverage for health and other related services for the nation's most economically disadvantaged populations. Some of the health insurances that work along with it are Aetna, Mutual of Omaha, Cigna, Blue Cross and Blue Shield, United Healthcare, and Sunflower Health. Coverage for disadvantaged people who include low-income children and their parents, pregnant women, and people with disabilities. Under the Patient Protection Act and Affordable Care Act, other low-income adults may get coverage depending on state policy. You'll have to check with your local Medicaid office for more information. Some individuals automatically qualify for Medicaid by virtue of their participation in certain programs such as Social Security income, or if they are children in foster care. If you are eligible for Medicaid, you can enroll through your local Medicaid agency, which is located at the Department for Children and Family Services Center on 402 State Avenue in Kansas City, Kansas. Their phone number is 913-279-7000. Their number for their telecommunication device for the deaf is 1-913-279-7501. You can also fill out an application online through CanCare, Medicaid for Kansans, or through the Health Insurance Marketplace. Both links will be in the description box below. CanCare's website will look like the top image on the right, and the Health Insurance Marketplace will look like the image on the bottom. If you have any questions about Medicare, you can call the Medicare hotline at 1-800-MEDICARE. For questions on Medicaid, you can call your local Medicaid office at 913-279-7000. Or if you'd like to talk to someone about Medicaid or other insurance issues, SHICK offers a free program that allows you to speak with a trained community volunteer. To do so, you can contact the Area Agency on Aging at 913-573-8531. That brings an end to our presentation. So if you like our content, check out the Unified Government of Wyandotte County, Kansas City, Kansas YouTube channel at www.youtube.com/c/unifiedgovernment. Once there, click the playlist tab and choose Wyandotte Leavenworth Area Agency on Aging. Be sure to like, subscribe, and share. Or join us on our Facebook group, Wyandotte Leavenworth Area Agency on Aging. If you'd like to speak with the Council on Aging, their office is located at 1830 South Broadway Street in Leavenworth, Kansas. Their main office phone number is 913-684-0777. And their office hours are Monday through Friday, 7 a.m. to 4 p.m. Like to get in touch with the Wyandotte Leavenworth Area Agency on Aging, their office is located at 849 North 47th Street, Suite C, in Kansas City, Kansas. Their main office phone number is 913-573-8531. You can visit their webpage at www.wycokck.org/aging, or you can email them at 60plus@wycokck.org. Their office hours are Monday through Friday, 8 a.m. to 5 p.m. On behalf of the Area Agency on Aging, we'd like to thank you for joining us today and hope the information we provided has been helpful to you. Be sure to check out more of our videos and have a great day.